In the second half of the program, we will be honored to be joined by Dr. Joneigh Khaldun, is the Chief Medical Executive for the State of Michigan and Chief Duty Director for Health in the Michigan Department of Health and Human Services. She will give us an update about COVID-19 vaccine, a quick review of the safety and benefit of vaccines, mask requirement, and timely to return to normalcy. Good morning, Dr. Khaldun, and thank you so much for joining us today.
Good morning. Thank you for having me on.
We want to thank you so much for being with us. This is really an honor. And we just wanted to give, as part of our effort to inform our community about the vaccine, about the safety of it, and what they needs to be done. If you would please give us a quick update where we are, and as far as the vaccine and as far as the COVID progress here.
Absolutely. So very pleased with our progress when it comes to COVID-19. We are seeing our case rates come down. The percent of tests that are being done that are coming back positive, so that test positivity rate is coming down as well. The number of patients that are coming into the hospital with COVID-19 is also coming down. Still present. I still practice in the emergency department. I'm still taking care of patients and admitting them to the hospital, unfortunately, for COVID-19. But we are certainly in a much better place than we were 6 to 8 weeks ago. When it comes to our vaccines, which really is the reason why we're seeing such great decreases in our cases, it's over 8 million doses in arms since we started this initiative back in December. Over 57% of adults over the age of 16 have gotten at least one dose. Over 75% of people over the age of 75 have gotten at least one dose. And we have over 44% of people fully vaccinated, so those 16 and up. So a lot of great progress. Was also really pleased that almost 2 weeks ago now, the Pfizer vaccine became authorized for kids between the age of 12 and 15. I have 2 children in that age group, so I was very excited to bring them myself to get their first dose of the vaccine. And so really, really pleased. We're able to do more when you're fully vaccinated.
Speaking of vaccinating young people, there has been something on the news in regard to some worries in regard to heart issues. Is that something we need to worry about?
Yes, the CDC is investigating a handful, very few cases of something called myocarditis, which is basically an inflammation of the heart tissue, which is very, very mild per reports that we've gotten from the CDC. I will say that these vaccines, they're safe, they're effective. The U.S. has the most robust safety monitoring system for these vaccines, better than really anywhere else in the world. Even several weeks ago, when we paused on the Johnson & Johnson vaccine for just a handful of cases out of the 7 million doses that have been administered across the country, I think that shows how robust and efficient our vaccine monitoring program is.
Is there a direct link to the vaccine, or this is only suspicions right now?
Right now, it's still too early to tell. And again, the CDC, as soon as they identify anything, they let us know and they investigate it. So it's still really too early to tell. But it appears that from the handful of cases that we're not even sure if it's really caused by the vaccine in the first place, that still remains to be seen. But the cases that they've identified are very mild. I will say what I am concerned about is the risk of COVID-19, the disease itself, the virus itself. Particularly in children, we have this very severe syndrome, MIS-C, where children can have their kidneys, their heart, their lungs, many organs inflamed, and some have even lost their lives, including right here in Michigan. So that is something that I'm quite frankly more concerned about when it comes to the actual virus itself, as far as getting our children sick.
So it is a risk factor, and the risk of complication from the virus much higher than the risk from the vaccine itself.
Absolutely, that is correct.
And how about hesitancy in regard to, how are you dealing with that as a state? There's still a lot of people hesitant. We haven't gotten to the 70% we had hoped that we would get to.
Yes, I understand that people may have questions about the vaccine, and I think it's on us and government, on doctors to make sure that we are providing opportunities for people to be able to have their questions answered. So we are doing a lot of work with community members, with faith-based leaders, working with, again, people in the community to make sure that they can have their questions answered. But I think it's also about access. Some people don't have a car, or they're more likely to get a vaccine if it's in their neighborhood. So we're making sure that people have access to the vaccines where they live.
Absolutely. Before I ask you about the mask issue, I think Laila has a question about traveling. Go ahead, Laila, please.
As a matter of fact, before this, Khalil, I would like really to ask Dr. Khaldun. We received some concern from our listener, doctor, about the CDC's recommendation of removing masks for vaccinated individuals. Have we reached enough vaccination to obtain herd immunity and safety remove mask for vaccinated individuals, or do we think that we should continue to mask up to protect those who cannot yet be vaccinated, such as the children, for example?
That is an excellent question. And I will say that the data shows that for people who are vaccinated, fully vaccinated, so 2 weeks after their last dose of the vaccine, they by and large are protected. They're probably not going to get the virus, and they're probably not going to spread it to other people. And even if they do get the virus, many people don't have symptoms, or they're certainly not severely ill, which is really great news, and why the CDC put out their guidance. I will say at the State Health Department, we have still recommendations for masking. So people who are not yet fully vaccinated should still wear masks in outdoor settings and in events, such as live performances or parades. People who are not yet fully vaccinated, and quite frankly, people who are fully vaccinated, should still be wearing masks when they're participating in contact sports. People working in jails, prisons, healthcare settings should also be wearing masks. So the pandemic is certainly not over. So yes, we still need to be wearing our mask in many places, especially if we will be around those who are most vulnerable and not fully vaccinated.
So places they allowed people to maybe come inside without mask. How they do determinate? I'm sorry, they were vaccinated, doctor.
Yes, we are asking businesses right now to do that by and large. I will say I recognize that things may not be in an order anymore, but there is still an opportunity for people to do the right thing. And if you are concerned about either your health or the health of those in your household, you still are able to wear a mask. But again, the data does show that for people who are fully vaccinated, you by and large are protected from getting sick or spreading the virus to other people.
Is there any update on vaccination for children and going back to in-person school this fall? What about college students?
Yes, so we are seeing many colleges make the choice, and it is their choice to mandate vaccines for those who will be coming back to their campuses in the fall. The CDC still recommends that children in school and staff and teachers in schools still wear masks regardless of vaccination status, because we know, as to your earlier question, that a lot of children still are unable to be vaccinated or who have not been vaccinated. So we still are recommending masks in those settings. And again, as more and more data comes out, hopefully we will see the younger age groups have a vaccine authorized for them as well.
To go back to the children, actually to adolescent, 12 to 15, what signs should I be looking for to, find out whether, if my son is taking the vaccine, what should I be watching for to make sure they're not affected by the vaccine?
Absolutely. So I think it's important to note that just like for adults, you will expect some mild side effects. So soreness at the arm, particularly with the second dose, people may have a mild fever. They may have a little bit of achiness. So that is something that is normal. But if you note that someone has a very severe headache or is not acting appropriately, again, something that you really do not expect at all. But if it does happen, you certainly should seek medical care. But that is something that is very, very rare.
Laila, do you have any other questions in regard to traveling?
Yes, doctor. What about traveling for vaccinated and unvaccinated individual? What are the recommendation or updates do we have?
Yes, so the great news about those who are fully vaccinated, who are traveling within the United States, is that if you are fully vaccinated, you by and large don't need to quarantine and don't need to test when you're traveling. Now, of course, that differs if you are traveling internationally, and of course, you should check with whatever country you are traveling to or coming back from when it comes to those recommendations. But if you have no symptoms and you are fully vaccinated, you do not need to quarantine when it comes to traveling within.
That's a good news, doctor.
It is. That's right. Exactly.
So we're gonna enjoy traveling domestically without going to do a test, right, for vaccine, right?
That's right. If you are fully vaccinated, you do not need to quarantine. Of course, if you do not have symptoms, right? So if you don't have symptoms and you're feeling fine, you do not have to quarantine and test.
If we're traveling outside the United States, do we need to be concerned? Where is that country we're going to as far as the vaccine to make sure that they have the right regulations? Because, a lot of countries are not as fortunate as us, getting hold of vaccines.
Yes, you should certainly check and see what the circumstances are in the country that you're traveling to when it comes to, one, their quarantine and testing requirements, but also how COVID-19 is spreading within that particular country. We know there are some countries that have different variants that are circulating right now. Of course, unfortunately, we've heard a lot about India in recent weeks and the terrible way that the virus is impacting their community. So you certainly should check as far as what's happening in the country that you're traveling to.
Absolutely. Do you have any more questions, Laila?
Just the million question, doctor. At what point we will reach enough vaccination for life to return to normalcy?
Yes, we certainly are hoping for that 70% operational goal, but that 70% is not herd immunity, very likely, because we have these more easily transmitted variants. So we will need to get even beyond that for us to be able to get back to 100% normalcy before we knew about COVID-19. But I am very optimistic. We are getting there. We have access to vaccines, and we are making sure that people are getting shots in arms. So I'm quite optimistic.
Well, we haven't really reached 70%, and then the governor is talking about possibly removing most of the restrictions. I believe it's next month. Are we rushing into this, or is it something that if we need to, we can always go back and institute some of those?
Yes, I think it's important to note that, again, these vaccines, they're safe, they're effective, and that's why we're seeing our cases come down as much as they are. We still have and will continue to have public health guidance for everyone to make sure that they're being safe. We have it right now when it comes to masks and what people should be doing if they're vaccinated or not vaccinated. But we're all in this together. If we all do the right thing, we'll be able to get out of this pandemic more quickly.
Absolutely. It's been really tough trying to get information, straightforward information. And the reason is, number one is, this virus has been evolving. We didn't know much about it, and we're learning more and more every day. Also, a couple of years ago when it started, or a year ago, there was a lot of politics involved. And this may be why some people are hesitant or getting, the wrong information. What can we say to them?
Yes, I totally understand. And it is unfortunate, quite frankly, that politics has played such a role in public health in this country throughout this pandemic. But I think it's also important for people to talk to their doctors, talk to trusted public health officials, talk to your family members who have gotten the vaccine and see how they're feeling. I think we need to be able to seek out the appropriate information and make sure we're getting information so we can protect ourselves and our families. But it is unfortunate that, unfortunately, politics has gotten a little bit in the way of public health in this country.
Absolutely. Is there anything we haven't asked you that people need to know?
I would just say, the pandemic is not over. We still have to continue doing those basic things, social distancing, making sure we're trying to go outdoors as much as we can instead of indoors. And the most important thing is get your vaccine as soon as you can. The pandemic is not over. We still have a lot of virus in the community. There are still people coming into the hospital, so it's not over yet.
Dr.
One
Khaldun,
thing that I'm sorry, go ahead, Laila.
Dr. Khaldun, I think we want to confirm one fact today, that taking the vaccine is the only thing we can get through the pandemic and get back to normalcy life. Am I correct, doctor? So this is the fact we should learn today from today's interview.
That is right. The best thing, the most important thing we can all do to get back to normal is to get vaccinated as quickly as possible. That is correct.
When it comes to India, they're really suffering tremendously, and most likely there'll be strains there that gonna be new. Are we doing anything as a state to make sure that people who travel there and come back are being, asked to take a test or be monitored somehow?
Yes, we do it with our local and state health departments. We're very aggressively monitoring people who may have been traveling from India. If people are test positive, we are actually sequencing, so checking to see if it is the newer variant that has come out of India. So we are absolutely monitoring that.
Yeah. And the last question for me is an easy one. I'm looking at your title. It says MD, I know what that for, and then it says MPH, and then it says FACEP. What do they mean?
The FACEP means I'm a fellow of the Academy of the College of Emergency Physicians. So I'm an emergency physician, and it comes with that.
Okay.
FACEP.
And MPH?
Master of Public Health.
Okay.
That's another
degree. I'm like, what do all these acronyms mean? So,
Masters of Public Health, yes.
Yeah, well, we want to thank you so much for being with us. Any other questions, Laila, before
No, thank you so much, Dr. Khaldun. Great to be with us always. Thank you so much for taking the time and being with us today.
Absolutely. Thank you for having me on.
We appreciate it. Thank you so much. Bye now.
That was Dr. Joneigh Khaldun, the Chief Medical Executive for the State of Michigan and Chief Duty Director for Health in the Michigan Department of Health and Human Services. Stay tuned after a quick commercial break.
A mask is more than protection. It's a bridge to better days, the path back to celebrations with family, nights out on the town with friends, game days with your favorite sports teams, and the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful, because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Welcome back to the show. لا يزال معي الزميل العزيز خليل هاشم. أعتقد يعني الرسالة خليل كانت واضحة من الدكتور خلدون. لا يوجد حل لتجاوز الأزمة والخروج من هذه الأزمة إلا أن نصل إلى مناعة القطيع بالتلقيح لأكثر من 75% ربما أو أكثر من مواطني الولايات المتحدة الأمريكية. هل ما يعني لخصته بشكل دقيق خليل؟
اي بلا شك. اولا الفاكسين، ثانيا مثل ما تفضلت وقالت دكتور خلدون انه بعد البانديميك ما انتهى، المشكله بعدها موجوده، ولكن نحن بحاجه ان نسيطر عليها. اولا الفاكسين، بعدين اذا في مجال السوشيال ديستانسينج، بعدين التباعد اذا بيكون في التباعد اذا مضبوط التباعد الاجتماعي، بعدين قضيه الماسك. لانه المشكله وين ليلى؟ يعني اذا شفنا شخص نحن ما بنعرف انه هذا الشخص هل انه هو فاكسينيتد او لا، هل هو ماخذ الطعم ولا لا، فهذه بتعمل صعوبه. بعدين المعلومات اللي عم تنتشر على السوشيال ميديا، يعني من يومين بيتصل في شخص بيبعث لي فيديو بيقول لي انه اذا بتحط مغناطيس على ايدك محل ما حطيت الطعم بيلزق لانه حطوا لك تشيب هونيك. قلت له اول شيء التشيب مش معموله من حديد بيلزق فيه المغناطيس، يعني تشيب او بتكون تيتانيوم او بتكون من مواد ثانيه بتتفاعل مع الجسم، اولا. ثانيا قلت له اوكي خلينا نجيب مغناطيس لانه انا مطعم، حطيناه على ايدي مكاني. قلت له بعدين ما شفتهم اني لما حطوا الطعم، يعني كان في ليكويد، ما كان في سائل، ما كان في شيء تشيب بالجسم.
يعني أنت لخصت هذه المشكلة بانتشار المعلومات المغلوطة على السوشيال ميديا، والذي تحدثنا عنه مرارا وتكرارا. خليل، استمرار نظريات المؤامرة باختصار خليل، يعني لماذا هذا الجدل إلى اليوم فيما يتعلق في اللقاح؟
هو شغلات كلها شغلات سياسية. هاي أولا عندك أنت نزاعين هون، عندك نزاع بيقولوا له نورث ساوث هو الشمال والجنوب، البلدان المتقدمة والبلدان المتخلفة أو البلدان الغير متطورة إذا صح. دائما البلدان الغير متطورة، العالم الثالث عندها الفكرة إنه البلدان المتطورة بدها تسيطر عليها، بدها تتحكم فيها. فهيدي بتجي من، وهو في بعض الاليمنت لها موجوده يعني، ولكن هيدي بتجي من هذا يعني من هذا النسيج بتجي منه هيدي. الشغله الثانيه والمهمه وهو انه السوشيال ميديا اليوم كل الناس اكسبرتس. اوكي، الشغلتين اثروا بالعالم، وهو الفرد عمل الجبان شجاع، والسوشيال ميديا والفيسبوك من ما كان في يكتب صار اخصائي بكل شيء. بتشوف الواحد اخصائي بالنووي واخصائي هو ما بيعرفش يكتب اسمه يمكن. فهيدا من السهل انه الواحد شير انفورميشن حتى يبعث معلومات على السوشيال ميديا ويحكي بهذا الموضوع، والناس ما عندها شيء، قاعده بالبيت. يعني في ناس كثير قاعده بالبيت ما عندها شيء يعني.
خليل، إذا فيني لخص معك في دقيقة، لأنه في عندي سؤال مهم كتير ب3 دقائق فيما يتعلق بسوق العقارات وجنونها. يعني على الرغم من تراجع كل القطاعات في موضوع البانديميك وجائحة كورونا، إلا العقارات، سوق العقارات يزداد جنونا. يعني إذا بتلخص لي أهم ما قالته الدكتورة خلدون في دقيقة.
أهم ما قالته وهو إنه بالعربي، مش هيك بدك يعني لخص
عربي طبعا نحن حكينا
أهم شيء طعم. إذا طعم كتير مهم، هو التيكت الوحيد حتى نحن نخلص من هذا البانديميك. الناس المطعمين مش الأدلة عم تفرجي إنه الناس المطعمين ما الماخذين الطعم، يعني ما مش عم بينقلوا الفيروس، ومش هن مش عم بيسخنوا، وعشان هيك الأرقام عم تنزل. فعم بيفرجي الطعم إنه شغلة كتير مهمة. بعدين هيدول اللي عم بيسافروا ومطعمين ما في لزوم إنهم ياخذوا تيست ويعملوا حجر ويعملوا شغلات تانية
دوماستيكلي، يعني داخل الولايات المتحدة الأمريكية، إلا إذا مثل ما فهمت من الدكتورة، إلا إذا كان في عليهم علامات أنهم ربما مصابين أو في عندهم إصابة. غير ذلك يعني الجود نيوز أنه ما بدنا ناخد التست أجين اللي هلكونا في كل دقيقتين، خد التست ورجع. تمام.
بنفس الوقت بدنا نضلنا نلبس الماسك از ماتش يعني قد ما فينا، لأنه ما بنعرفش من هو اللي بياخذ الطعم ومين مش بياخذ الطعم، وحتى نحمي حالنا ونحمي غيرنا يعني. وبنفس الوقت انه نكون على حذر، يعني بعد ما رجع كل شيء لمجرى الطبيعي بدها تاخذ وقت القصة. واهم شغله قالتها هو انه كلنا بدنا نشتغل مع بعضنا حتى لي
نرجع لحياتنا الطبيعية، نعود إلى حياتنا الطبيعية،
وما نسمع يعني شو ما سمعناه ما دغري نصدق، ناخذ المعلومات من المصدر الأساسي. science العلم is perfect and إن شاء الله إنه نخلص من هالأزمة عن قريب.
شكرا لك خليل، شكرا لكل من تابعنا. هذه ليلى الحسيني تحييكم، إلى اللقاء.